turned on?
No, it's
You just do it?
I was just checking to see if the mic was on.
Like you always do it, no?
Yeah, cause see if you tap, you see the little thing. You see it, right?
Oh, yeah.
Yeah, so I just want to check if it's actually picking up the sound, cause you could actually record it and it won't pick up any sound, and then it's like, why did you even record in the first place? You know, you see what I'm saying? So it's really important.
Yeah.
But anyhow, all right. So how are you guys doing? Good. How? Oh, you're surviving. I feel you. I feel you. It's rough. It's rough. So have you guys looked at the lecture? So what did you guys think of the lecture? It wasn't bad.
That's a lot of information.
Okay.
So if you know anyway how to
Simplify. Because that's what we're gonna try to.
Or if you know what we don't actually need to know.
All right, so I'm gonna do my best. I'm gonna try to tie in a lot of ideas, and I'm gonna try to give you guys little mnemonics, especially for the arteries and like the nerves. Hopefully, I'll try to give you guys a better global picture of everything from the lecture. All right, so starting off here, so the lecture was given by Dr. Shaw. What did you guys think of the lecture? Or did you guys didn't go? You guys at least watched Integrity, right?
I went.
What did you guys think? Was it?
It was okay.
Okay,
There's
straightforward.
a lot of information.
Okay. Okay, so we're looking at the temporal region. All right, so what we're gonna do, so we're gonna start off and we're gonna consider just like the osteology. All right, so we're gonna look at the bones. We're gonna pay, I guess, particular attention to like the more of like the important bones. All right, that is related to this temporal region. It's just kind of a vague term, but we're gonna try to, kind of elucidate better what we mean by this temporal region. So, but we're gonna look at the osteology, all right? And after we've considered that osteology, then what we're gonna do is we're then going to look at the different cavities or fossas, all right? So the different fossas. I don't know if there's such thing as fossas, but I think it's just better just to call it cavities. All right. So there are three main fossas or cavities that we're going to consider. All right. So we're going to have the temporal fossa. All right. We're going to have the mesenteric fossa. All right. And then we're going to have the infratemporal fossa. All right. So you guys just may be kind of getting an idea of this. So temporal, right? It's where like you have the temporalis muscles around there, right? Then mesenteric fossa would then be like where you have the masseter, right? So you have the temporal and we have the masseter. Then infratemporal, it's more like it's beneath the temporal, but it's like it's behind the ramus of that mandible. All right, so that's how you want to imagine these fossas, right? Okay, so we'll consider osteology, important bones. All right, so once we have the bones and we start to get an idea of how we're getting these fossas to begin with, right? Then, so once we've established these fossas, then what we're going to do, we're going to look at the content of these fossas, right? So we're going to look at the content. So for the temporal fossa and the mesenteric fossa, their content is relatively simple. All right. content is relatively simple. It's like a muscle in there. There's really no critical structures that are going to be of particular importance to us. But I'll still point them out to you guys, so then you guys have an idea. And then we'll also be considering like the boundaries of these fossas, right? All right. So it turns out that this infratemporal fossa, so it has a lot of stuff in there. So there's a lot of stuff. All right, so this is the this is the one that, you know, so that's like the material in the lecture was coming from this guy right here, right? There's a lot of stuff behind that ramus of the mandible. There's a lot of stuff there. So the bulk of our time we're going to spend on this this infratemporal fossa, and we're going to look at the contents. So in terms of the content, so I think there's four major things. So we're going to consider the maxillary artery, right, and its branches. Then we're going to consider the pterygoid, I believe it's the pterygoid venous plexus. Let me assure myself. Yeah, that's right. So it's a pterygoid venous plexus. Then we're going to consider the trigeminal nerve branches, specifically the mandibular, right? All right, so that's V3, right? So that's also part of the content of this infratemporal fossa, right? How well are you guys seeing this? Okay. All right. And then lastly, we also have the lateral and the medial pterygoid muscles. All right. All right, so this is basically what we're considering. So first of all, we're going to look at osteology. So we'll look at some bones, define the fossas, what are the boundaries of these fossas. So there's three major fossas that we're going to be considering. All right, so we're considering the temporal fossa, the mesenteric fossa, and the infratemporal fossa. All right. So for the temporal fossa and the mesenteric fossa, the their content is relatively simple. All right. But when you're looking at the infratemporal fossa, there's a lot of stuff there. And what are we going to find there? This is what we're going to find there. All right. So we're going to find the maxillary artery with its branches. All right. So we're going to look at that. I'm going to do my best to kind of break it down for you guys and give you guys a way to remember it. We're going to see the pterygoid venous plexus, the trigeminal nerve branches, but the one that we're focusing on is the mandibular, V3. And then we're going to have the lateral and medial pterygoid muscles. All right, so beginning off here. So beginning off with the osteology. So first thing we want to consider are the bones, right? Because that's going to give us the framework to kind of considering everything that we're looking at, right? So here we have a skull, and what we see here. So this is the parietal bone, right? This is the frontal bone, right? Occipital bone. Here we have the temporal bone, right? Zygomatic bone. You guys probably already know this already, right? Sphenoid bone. You have the maxilla. You have the nasal, right? You have the lacrimal. You have the mandible. right? You guys already know this. I'm sure you guys already know this, right? So this is simple stuff. All right. So I guess diving a little bit closer. So considering the temporal bone, right? So there's different parts of the temporal bone. So you have the squamous part, you have the petrous part, you have the zygomatic process, you have the styloid process. So maybe going over here to just demonstrate that. So here, and this is temporal bone, right? So here's the squamous part, right? You have the petrous part over here. This is the mastoid process. This is your styloid process. And this is the zygomatic process, right? All right, so that's that for the temporal bone. All right, then we have the sphenoid bone, right? So for the sphenoid bone, we have the greater wing. Yeah.
So the part of the temporal bone, the petrous part, did they usually call it petrous or petromastoid?
That's what I remember from last year. I remember petrous, but I think you can also use petromastoid because it's around the same region. So like this is the squamous part. So squamous is like more flat, right? Like it's more flat, whereas the petrous is like it's more dense. So that petrous mastoid, so like that mastoid area is around that petrous part. So you can kind of see why you would say petrous mastoid, right? All right, so sphenoid bone, we have the greater wing, the lesser wing, medial, and the lateral pterygoid plates. And so here, again, remember the sphenoid bone was right here, right? So this is just looking at let's call this a cross section. So here, this is the posterior view of the sphenoid bone here, right? So here we have the body, we have the greater wing, then we have the lesser wing, right? And then just kind of focusing on this, we have this medial pterygoid plate, and we have the lateral pterygoid plate. And this is just showing the same thing again with the temporal bone. The way you want to visualize this will be anterior and this will be posterior. So if you want to connect this to an actual human, let's see, so it'll be something like, it'll be like this. Hopefully I get this. So maybe around here, it'd be like the mouth region or something like that. So this would be like the orientation of it. You guys see it? So here you have the zygomatic process. You have the styloid process, petromastoid, like we said, petromastoid, so like around here. You got the squamous part. All right, so that's that for the sphenoid bone. All right, then for the mandible, so we have the ramus, the body, the coronoid process, the condyle. So here we go right here. So this is the mandible. All right, so this is the coronoid process. All right, we have the condyle, we have the ramus, right, and this is like the body right here, right? All right, and of course we have the zygomatic bone, which we already pointed out that it's right here. It's a zygomatic bone. And then the maxilla, which is just right here. Right, so that's the maxilla, right? All right, so that's a little bit of an introduction for the for the osteology. Okay, so now that we kind of started to lay the framework down, so now we need to actually consider the cavities. All right. So the title of this lecture is the temporal region. So this is a bit ambiguous because in the lecture she points out 3 cavities. So it's a bit ambiguous because if you're saying temporal, are you actually just talking about here? Like, are you just talking about here? And that wouldn't make sense, right? So I think the temporal region is actually including like all this right here, right? Just to be, you know, a little bit more precise what we're saying by temporal region. So there, like I said, there's 3 cavities, right? So we're gonna have the temporal fossa. Okay, I don't like this. All right, so we're gonna have the temporal fossa. All right, we're gonna have masseteric fossa. All right, so temporal fossa is just basically where the temporalis muscle is, right? And the masseteric fossa is where the masseter is, right? It makes sense, right? And then we have the infratemporal fossa, which is below the temporal fossa, but then it's behind the ramus of the mandible, right? That's how you want to visualize the infratemporal fossa. So each of this cavity or fossa is going to be covered by a fascia, right? So each of the cavity or fossa, these fossas, they're going to be covered over by a fascia. Okay, so let's look at it a little bit in a better way. Okay, so here, this is like a coronal cut. So the way you want to visualize this is, okay, say, okay, let's see here. So let's just say, you know, you just cut the skull like so, or something like that. So you have like a coronal. I don't think this is I didn't draw this as well as I should. But do you guys see that?
Yeah.
So you get like a coronal cut, right? Okay, so here we have this is the cranial cavity. Wow, we don't really care about this. So here, this is the temporal fossa. Right, you guys see that? It's temporal fossa. Then here, this is your masseteric fossa. So you can see, right, the temporalis muscle would be here somewhere, right? And then the masseter will be here somewhere, right? And then we have the infratemporal fossa. So now notice, so it's infra, right? So that means it's below, right? So infra, below the temporal fossa. So this is the temporal fossa is on top. Now guess what is below, right? Makes sense, right? Now, maybe another way you can think about this is that not only is it below this way, right, but it's also, well, it's below this way and that way. You see that? So then it's here. So then it's infra in both senses of being infra, if that makes sense. Do you guys see that? So it's infra in both senses. So it's below. So if we're considering this temporal fossa, this infratemporal fossa here is below it, and then it's also below it if we're considering it like so. You see that? Okay, cool. So hopefully this will help you guys remember this. Okay, now, so what do you guys think this would be then? What would that be? Okay, so the ramus of the mandible. So if you're looking at this, right, so we're seeing that this infratemporal fossa is behind the ramus of the mandible. You see it? So it's behind the ramus of the mandible. And do you guys remember what these are right here?
Was that the pterygoid plates at the lateral?
Exactly. So this would be the medial, right, and this would be the lateral pterygoid plate. So it's important to just kind of start establishing the boundaries. Okay, so what I said, so we have these fossas, right? They're going to be covered over by fascia. right? So they're being covered over by fascia. That's what we're seeing here. Okay, so beginning off with the temporal fossa, right? We already know where it's located, but just to define it a little bit better, so the borders, you're gonna have you're gonna have the superior and inferior temporal lines, all right? And you're gonna have the frontal zygomatic bone with the zygomatic arch. So essentially, if you're looking at this here, all right, so this would be like the superior inferior temporal lines, and then you would have the frontal bone, the zygomatic bone, like you have the zygomatic arch as well, right? So that's just defining this, right? So this is your temporal fossa, right? Cool. Does everyone see that? Okay, I don't think Dolly is going to be here. Let me, So when we consider this temporal fossa, so we just established the boundaries of the temporal fossa, right? So the content is the temporalis muscle, right? Which is simply shown right here, right? It's temporalis muscle, right? Now, so something that was important that was pointed out in lecture is the pterion, right? So the pterion is this point right. Let me erase this really fast. So right here, this is the pterion, right? Do you guys remember from lecture what the what's so significant about this pterion right here?
Medial meningeal body.
Hmm?
Isn't it the medial meningeal body?
That's right. That's right. So okay, so we have the this is the pterion. So the middle meningeal artery. So the middle meningeal artery is behind it. So what's so significant about the middle meningeal artery being behind this pterion here?
Because the pterygon is actually pretty like a weak point within the skull.
That's
so
right.
When you get hit there or something happens along that and you end up rupturing the meningeal artery, you'll end up with a epidural hematoma.
That's right. So yeah, the pterion is the meeting place of, so here we have the parietal bone, right? The temporal bone, the sphenoid bone, and the frontal bone. So this kind of meeting point, it's not strong, all right? And so right behind that weak point, we have the middle meningeal artery. And so what happens is if someone knocks you, right? And so you're fighting someone, right? So let's say you were fighting me, right? If you're fighting me, I mean, I'm not gonna, Okay, all right, that's not a good example. Let's choose someone else.
Kwame, if you're fighting Kwame.
Oh, Kwame, yeah, that's a good example. Okay, so let's say you were fighting Kwame, and let's just say, God forbid, right? So he hits you, right, on your temple, and he hits you right here. So if he hits you right here and he fractures this bone right here, or this region right here, and he can rupture this middle meningeal artery, and you can end up with, you guys know?
Epidural.
Yep, epidural
Is that kind of
hematoma.
the talk and die?
Yep.
Yes.
Welcome to death.
Yeah, it's pretty much like you're conscious and you're able to function, then all of a sudden you're just gone.
Yep.
Bye.
Yeah, so you guys know the difference between the epidural and the subdural?
Yeah.
So it's epidural, because of the sutures in the right, in the dura, is attached to the sutures. Some
Okay.
is attached to the sutures.
Because the dura is still intact, like
Yeah.
it's not, because it's above the dura,
Mhm.
then the dura kind of protects the suture, so it's
Yes.
right.
So basically you have the pooling of blood there and the push on the brain.
Yep,
will-
yep.
While the subdural, the blood can kind of spread out all over the brain.
Yep. That makes sense.
But
All
this
right.
one could push too, the epidural.
The epidural.
Yeah, because isn't the meningeal like the bottom layer is hard, so it could like the blood could be trapped there and it's gonna push the whole brain.
Oh, it's the
Yeah.
unused, like
Oh,
it's the, I don't know, like, is that unused?
Yeah.
It causes herniation, like it
Yeah.
shifts it
Oh,
over to
okay.
the unused, like herniates the temporal.
So you get like respiration problems and all that.
Okay. Okay, so let's try to. Okay, so number one, so hematoma, right? So this is where you basically have like a bleed, right, inside of your body. So that's the first thing. Hematoma, you having this bleed inside of your body. So epidural, so we have the dura mater, and we're saying we have a bleed, and that the bleed is on top of the dura mater. So on this side here, right? So this is the dura mater, right? And we're saying that we rupture here, the middle meningeal artery, right? And so what happens is that the blood is going to be on top of the dura mater. So we have a bleed, that's a hematoma, and is on top of the dura mater, so it's epidural, right? Whereas if it was subdural, then we're saying that it's below the dura mater. So in this case here, this is a subdural hematoma because the bleeding is behind the dura mater. So like what was said, so the blood here can spread across the brain, whereas over here it can't really spread, right? Because this would be kind of be keeping it like in the same place. All right, so that's that. This is just another example of the middle meningeal. So remember that the middle meningeal is a branch of the maxillary artery. All right, so the middle meningeal is a branch of the maxillary artery, and it actually has two branches. So it has an anterior branch, and it has a posterior branch. All right, you guys see that for the middle meningeal artery? All right, so Osbon,
Yes.
were you here?
Yes.
Are you still here?
Yeah.
You sure? All right, so what were the three cavities that
mesteric, temporal, and then the infratemporal.
Okay, that's right. So which one has the most amount of contents?
Infratemporal.
Okay, infratemporal. And where is the infratemporal fossa located?
Behind the mandible.
Okay, that's right. Okay, cool. These are easy questions, so you guys should. All right, so Alexander. So these fossas are covered over by.
Fascia.
Okay, cool. These are pretty simple questions. All right, and Alana. All right, so we said that the weak point was what? What was that weak point called? Okay, the pterion. Okay, cool. Okay, so we just established the temporal fossa. So notice that the pterion, right, is closely related to the temporal fossa, right? All right, just pointing that out. So again, it's the epidural hematoma, right? And it's the middle meningeal artery that is being ruptured. Now we have the mesenteric fossa. Now, Dr. Shaw didn't really demarcate this in her lecture. At least I didn't see it in her slides. But the content would be like the masseter, and you guys should kind of have an idea of the boundaries. I would suppose you should have an idea. Now, getting into the infratemporal fossa. Now this is the main one that we're going to be concerned with. So the borders. All right, so we're going to have a lateral medial, superior, inferior, anterior, posterior border for the infratemporal fossa. How well do you guys know the boundaries for this? Are you guys like, do you guys know the boundaries?
In theory, I could probably guess it,
Okay.
but not hard.
Can you guys visualize the boundaries in your head? Because I want to see how much, like how in-depth I should go on this.
We had to know where it was.
We know, it was kind of like, oh,
I wouldn't have said like,
Okay.
wouldn't have thought she was gonna be like, what is the anterior border of the?
Okay, so
She might pull that out.
and that'd be pretty, like, why would you ask me?
okay, so let's look at this, okay?
I mean, I know
So-
you know petty things, right?
Okay, so the first thing is, so this is what we said right here. We said here we have the infratemporal fossa, right? Now let's just use this to kind of get started, right? So here, this would be your lateral border, right?
Yeah,
And this would be your medial border,
yes.
right? And this would be your superior border, and this would be your inferior border. All right, you guys see that? So that means that your lateral border is going to be the ramus of the mandible. Your lateral border, meaning here, it will be the ramus of the mandible. Your medial border is going to be that lateral pterygoid plate, right? Now your superior border is going to be, it's going to be like the sphenoid bone. It's like the superior. It's what is it? Infratemporal. Is this superior infratemporal part of the? Let me pull it up. Okay, so superior is the infratemporal crest of the sphenoid bone. That's what it's called. All right. So, but it's just this right here, right? And you guys can see that this is the sphenoid bone because we have this pterygoid and we have this sella turcica, right? So we know this is the sphenoid bone, right? So it makes sense logically, right? Now, this bottom part here, this lower boundary here, so the inferior boundary is going to be the angle of the mandible. All right, that's what she had in the slides. Angle of the mandible. And now the last thing to specify is the anterior posterior. All right, so anterior posterior. Okay, so here. So remember, right? So lateral was the ramus of the mandible, right? Then medial was the lateral plate of the pterygoid, lateral plate of the pterygoid, right? Then we said for the inferior border is going to be the angle of the mandible, and then for the superior is going to be that crest of the sphenoid bone, right? Right?
Yeah.
So then for the anterior, now notice that here we have what? This is the maxilla. So anterior will be the maxilla, all right? And then posterior would be the styloid process over here. And that's it. These are your boundaries. So this here is your infratemporal fossa. Cool? So this is what we're getting ready to look at. It looks intimidating, right? A lot of stuff there.
A lot of words.
Okay, so that's the boundaries. Now in terms of the significant content, right? So we're going to have the lateral and the medial pterygoid muscles, one, like what we said before. We're going to have the maxillary artery, two. We're going to have the pterygoid venous plexus, three. Then we're going to have the trigeminal nerve branches. Specifically, we're focusing on the mandibular V3 branch. Cool? All right, so beginning off with the with the pterygoid muscles. So these pterygoid muscles are going to have two heads, right? Well, actually, there's two pterygoid muscles, and each of them has two heads. So we have the lateral pterygoid muscle, and we have the medial pterygoid muscle. So here. It's the lateral pterygoid muscle, and this is the medial pterygoid muscle. Now, each is going to have two heads. So this would have two heads, and this would also have two heads, right? Now notice where they're attaching, right? So notice that this lateral one is attaching close to the condyle, whereas the medial is attaching along the ramus of the mandible, right? Do you guys see it? Yes, maybe. Okay, so this is the lateral pterygoid. It has two heads. This is the medial pterygoid. It has two heads as well. So this lateral pterygoid is going to be attaching here at the condyle. It's a little bit different for the two. The upper one, so this the upper head and the lower head. So the upper head is actually going to be continuous with the cartilage, the cartilage of your TMJ, whereas the lower head is actually going to insert onto that condyle. All right. And then for the medial pterygoid muscle, so it's going to be inserting along the ramus of the mandible. You see it? Now notice that we cut out the ramus of the mandible in order to see the pterygoid muscles. Why? Because it's part of what? Why do we have to cut out the ramus of the mandible? Because the ramus of the mandible was the lateral wall of the infratemporal fossa. So we can't see the pterygoid muscles unless we cut out that lateral wall. Right? It would only make sense, right? So because, okay, so the content that we're trying to see, so the stuff that we're trying to see is in here, right? Now, if you're looking at the ramus of the mandible and you're expecting to see the pterygoid muscles, you can't see the pterygoid muscles because they're going to be hidden by the ramus of the mandible, right? So we have to remove that ramus, right, in order to see the pterygoid muscles. So that's what we see here. All right, so basically this is the mandible, and we remove that ramus, and then we expose the pterygoid muscles. Cool? All right, so that's that with the pterygoid muscles. So maybe one last thing. So for the lateral pterygoid muscle, we have an upper and a lower head. For the medial one, we have a deep and a superficial head. Cool? All right. This is Kathy?
Kathia.
Oh, Kathia. I'm sorry. I'm so sorry. This, I couldn't read it. It was a little bit.
Yeah.
Okay. All right. So Kathia. Okay. So, what would be the inferior border of our infratemporal fossa?
Angle of the mandible.
That's right. Angle of the mandible. And how about the medial wall?
The lateral pterygoid plate.
That's right. All right, dude. You gotta help me out now. You know it's better than I do. What is it?
Please.
It's Halloween.
Huh?
Yeah.
I'm
Please.
sorry. Huh?
Please.
Okay, so Felice.
Yep.
All right. So what would be the superior border?
The infratemporal crest of the sphenoid.
Okay. One second here. So let's just say this is lateral, this is medial, this is superior, and this is inferior. And then let's just say this is anterior and this is posterior. All right, so Osbon, what do we have for the posterior? What would be posterior?
The medial pterygoid.
You sure? Posterior. Posterior
Oh,
for the
my bad.
infratemporal. This is the infratemporal fossa. I'm sorry. So what will be posterior?
The
The-
floor of the mandible. The angle of the mandible.
Now the floor of the mandible. Anyone want to help Osmond out? So the styloid process. So remember, let's go back here. So this would be anterior and this would be posterior. So the anterior would be
I was
the
thinking inferior.
maxilla. So here would be inferior and this would be superior. Posterior would be what? The styloid process, right? Okay, cool. All right, so Osmond, how about the medial? What would be for the medial?
The medial pterygoid.
Not the medial pterygoid, though. Not the medial pterygoid. The lateral pterygoid blade.
Mm.
You see it? It's the difference. You gotta see the difference. So remember, there's two pterygoid plates. There's the medial and then there's the lateral one. The lateral one is closely associated with this infratemporal fossa. You see it?
Yeah.
Okay, cool. All right, so I'll let you guys answer this on your own. So where does the lateral pterygoid muscle insert? So where does the two heads of the lateral pterygoid muscle insert?
One of them was
The disc.
articular disc.
Okay. And that was for the upper one. TMJ.
No, that was like the mandible.
Okay. All right.
Okay, we're saying insertion, not origin. Okay.
All right, so here. So what we're seeing here, we have the lateral pterygoid, right? This is the superior head, and this is the inferior head, so upper and lower, right? So the same concept. All right, so what we're seeing here is for the superior head, you kind of see that it's continuous with this articular disc. So I guess maybe you can see it as inserting onto the capsule, I'm not sure. But it's continuous with this articular disc here. Whereas for the inferior head, it's just attaching to this condyle, right? All right, cool. All right, so that's that for the pterygoid muscle. So now going on to the maxillary artery, all right? So the maxillary artery is coming off of our what? External carotid, that's right. And the external carotid is coming off of what? The common carotid. All right, so for the maxillary artery, it can be divided into three regions, all right? So we're gonna have like a first part, second part, and a third part. So what we're gonna do, I'm gonna first show it to you guys, and then we're gonna try to break it down, all right? into something that you guys can maybe memorize or something. Okay, so here, right? This is your external carotid artery, and we see other branches coming off of here, such as the lingual, occipital, facial, right? So the facial would curve around like so. But what we're concerned with here is this maxillary. Notice that it's going behind the ramus of the mandible, right? It goes, but then it goes behind the ramus of the mandible. You guys see it? So that means it's now it's in the infratemporal fossa, right? Okay, so this is the maxillary artery. Okay, so here. So once again, external carotid artery. So this right here is external carotid. External carotid is going to give off several branches. One of such branches is going to be the maxillary artery. So this is the maxillary artery here, right? So beginning off, we have these two right here that are going close to where the ear is. So we're going to have the deep auricular and the anterior tympanic. So just kind of know that these two are going to be associated with the ear. So you have the deep auricular and then anterior tympanic, right? Then you're going to have two more vessels, and these guys are going to be associated with the brain, right? So I'm just trying to bunch these up so you guys can try to, associate this and make it a little bit easier for you to remember. So these guys are, going towards the brain, right? So we have the middle meningeal, and we have the accessory meningeal, right? Let's see, what is... I think this is showing that it's going behind the lateral pterygoid. I think that's what this is showing. Okay, now coming down like so, we have the inferior alveolar. Right, notice that. So look at what we have here. We have two vessels going to the ear, two vessels going to the brain, then we have the inferior alveolar. And then this is the end of the first part. Two vessels going to the ear, two vessels going to the head. We have the inferior alveolar, and then that's the first part. All right? Did everyone get that? I'm going to give you guys a way of remembering this as we go along. But I'm trying to break it down so that it's a little bit easier. So that's the first part. And this first part is associated with foraminus. So like going into like a foramen. So here we can see that this inferior alveolar is going into, what foramen is this again? Mandibular foramen? Okay, so it's going to the mandibular foramen, right? And so for the middle meningeal and the accessory meningeal, they're going to be going into their own foramens or foraminas. So the accessory meningeal is going into the foramen ovale, and then the middle meningeal is going into the foramen spinosum. Right. Now, I think these guys are also going into foraminus. I think, again, I'm not 100% sure on this, but Dr. Shaw linked these guys to like foramina. So this is one way to kind of link these arteries together in the first part, right? Now in the second part, the arteries are going to be associated with muscles. All right. So here, the first thing we have sticking off here is masseteric artery, pterygoid artery, right? Masseter, pterygoid, those are muscles, right? Then we're going to have the deep temporal. So we have two vessels here that goes to the temporal. So we have what? The masseter, the pterygoid, we have the temporal, and then we have the buccal. I believe this is to the buccinator muscle, right? So we have four arteries, right? Masseter, pterygoid, temporal, buccal. These are just muscles, right? They're just going to muscles. So the first part is foraminers, second part muscles, third part is going to be associated with your sphenopalatine fossa. Let me be sure about this. Oh no, wait. I think it's pterygopalatine. I think that's right. It's pterygopalatine, right? Yeah. It's pterygopalatine, right? Dang. This is what messed me up first year. Alright, pterygopalatine fossa. So they're going to be associated with the pterygopalatine fossa. So you're going to have this sphenopalatine artery, infraorbital, of this descending palatine. All right, it's not very clear in this image here, but I'm going to draw it out for you guys, so you guys can see it. But this is a better depiction. All right. So just going through the same thing again. All right. So here we have the external carotid artery. All right, external carotid artery. Now the first thing, we're going to have two arteries going to the ear. Right, two arteries going to the brain. Then we have an artery, right, that's going down, right, into the mandibular foramen, right. Okay, so that was the first part, like what we said. That was the first part, right. So for the ear, it was the deep auricular and the anterior tympanic, and then for the brain, it was the middle meningeal going into what foramen? Okay, so foramen spinosum, and how about for the accessory meningeal? Foramen ovale. All right, so this first part is associated with what? Foraminers, right? Now the second part, all right, we have the second part is associated with muscles, right? So here we have the pterygoid, the masseteric, buccal, and deep temporal. And that ends the second part. Right. And then the third part we said is associated with your pterygopalatine fossa. So this, all this right here, right? Associated with your pterygopalatine fossa. So we have the palatine, the posterior superior alveolar, we have the pharyngeal, we have the infraorbital, we have the sphenopalatine, and then we have the artery of the pterygoid canal. All right, do you guys see this? All right, so does this make this a little bit easier for you guys? A little bit easier? Yes? Okay, so let's try to make it.
Is Shaw requiring us to know all of them, or just the ones in red?
I think she wanted us to know, because we're going to go into that, I think, next week, but she wanted us to know sphenopalatine. I think posterior, superior, alveolar, like for sure.
Yeah. I was just looking at her PowerPoint, and there's certain ones that are red and certain ones that are not.
Oh, okay.
Yeah.
Can you do what the APP stands for again?
Yeah, I am. Okay, so anyhow, I try to create a little way for you guys to remember these. So I feel like these ones here for the first part is a little bit easy. If you can just bunch up the ear and the brain, I think you can pretty much figure out, because this is meninges, right? That makes sense. Brain, meninges, right? Ear, auricular, tympanic, it kind of makes sense for the ear. And then you just remember there's one going down to the mandible. Just remember the foraminers, all right? Then for this middle part, so this is just a little way, so a way of remembering these guys. So deep BMP. So deep is for deep deep temporal. So the deep is for deep temporal. The B is for the buccal. The M is for the masseteric. The P is for the pterygoid. Notice that it's in the same, like, I guess, orientation, kind of, so that you actually have the P, the M, and then the B, right? So it's almost like the same kind of orientation. But you got to make sure that you draw the maxillary coming off like this and not coming off like this, because then it'll be off. You see what I'm saying?
Mm-hmm. Oh, the order.
Yeah. Okay, and then this is a little bit random, but okay, so okay, but whatever helps, right? So is app. So you have an is app. So there's an is app on your phone. There's an app that says is. So so is an app with another P on there, right? And the order is like almost the same, right? So you have the palatine, the posterior superior alveolar, you have the pharyngeal, you have the artery of the pterygoid canal, then you have your sphenopalatine, and then you have the infraorbital. All right. It's just a way to get you guys to remember these.
Wait, what was
A is the artery of the pterygoid canal. And I'll try to quiz you guys a little bit later so that we can try to drill it into your head. Cool? So does this seem a little bit easier? A little bit, maybe? We're getting there? Okay. Okay. Okay, so that's that for the maxillary artery. Now we have the pterygoid venous plexus. All right. So this venous plexus is found around, like, where you have your pterygoid muscles. All right. All right. So this pterygoid venous plexus is gonna share anastomosis with the cavernous sinus, facial vein, maxillary vein. So here, show you guys this. So here, this is your pterygoid venous plexus. So you can see here, right? This is right here. This is actually your maxillary vein, right? Right, and then over here we're gonna have we have superior orbital vein. Then around here we have our cavernous sinus. So we can see that there's vessels that leads into this pterygoid plexus, right? Right. So we're saying that it's gonna share anastomosis with the cavernous sinus, the facial vein, and the maxillary vein. So going back, so here, this is our facial vein. Notice that the facial vein is running like the same way as the facial artery, right? And then over here, it becomes angular, right? So we see that this pterygoid venous plexus has anastomosis with the maxillary, the facial, and this cavernous sinus. Now another thing is, notice that the maxillary vein is drains into the retromandibular vein. All right, let me say that again. Okay, Osbon, what is this right here? You look very weak, so I'm trying to get a little bit stronger here.
The pterygoid plexus.
Okay, pterygoid what plexus?
Venous plexus.
Okay, good. So you were kind of here. All right. But what is this right here, though? What's that right there?
Pterygoid.
You see what I'm pointing at? I'm pointing at this right here.
Yeah.
What artery is this?
Vein.
Oh, shoot. I hate when this happens. Okay, yeah, that's right. It's a vein. It's a vein. That's what I meant to say. Okay, yeah. So here, what vein is this? So I want to see how.
Maxillary thing.
Okay. All right. All right.
I have a question that
Yeah.
might not be related at all.
Yeah. Go ahead.
What's swollen somebody like has a wisdom tooth thing?
It's a very good question. Does anyone know the answer to that
When
question?
you get one pulled up.
Will you get your wisdom teeth pulled out?
Like before, like some people get swelling here before their wisdom teeth get pulled out.
They do.
Yeah,
like
it
in
happened to my roommate, and I had like back in college, and I was like, whoa, like what's that?
Oh, her whole face was swollen?
Yeah, like here. Back.
Was it an infection? Was it an infection or like?
So
All
what
right.
was
So
that?
if it's an infection, then I mean you have inflammation and you got all the cytokines and
You just
you know.
got a whole lot of stuff, girl. A lot of
Yeah.
extracellular.
Thinking about this area.
Fluid accumulation. So that's probably what it is. Yeah, because you know if you have the infection, then your vessels are gonna like dilate. They're gonna become more porous, so fluid is gonna leak out into like interstitium, and so you get like the swelling. And okay, cool. All right, so pterygoid venous. Oh shoot, pterygoid venous plexus. Right. Then right below it, this is the maxillary vein. It drains into your retromandibular vein. Right. And this is your facial vein. Right. And both of them, they're dumping into your internal jugular vein. So this is the internal jugular vein here. Okay, cool. So that's that for the pterygoid venous plexus, all right? Now we're getting into the mandibular, V3, mandibular branch of the trigeminal nerve. All right, so we're also going to try to break this down, and so you guys can maybe remember this. So there are 3 major divisions. All right. So remember, the first thing is remember that this mandibular branch is going to come out of your foraminal valley. All right. So what was the thing that was coming? What was the other thing that was coming out that foraminal valley?
Doesn't it go in?
Okay, so the accessory.
Okay, go through it.
All right. Okay, so just remember, mandibular branch comes out of the foraminal valley, and then once it comes out, we're going to divide it into 3 major divisions. All right, we're going to have a trunk, we're going to have an anterior, and we're going to have a posterior. All right. For all intents and purposes, so this is okay. So for the trunk, it's actually 3 branches. This one here is just saying that it's the mandibular nerve. You guys see what I'm talking about?
Yeah.
So it's actually just 3. There's 3 in the anterior, and there is 4 in the posterior. So 3, 3, 4. Let's try to break this stuff down. So we have a trunk, anterior, posterior. So, boom. This would be foraminal valley. So what's coming down from this foraminal valley? Okay, so V3. And then what else? All right, so accessory, middle meningeal, right? Okay, now this V3 we said, so we're gonna have a trunk, we're gonna have an anterior, and we're gonna have a posterior. So let's just suppose, let's say this is our trunk, and let's say this is our anterior, and then this is our posterior. You guys can visualize this, right? Is this hard so far? No, right? Okay. So let's try to see. Okay, okay. All right, so the trunk we said had how many branches? 3. Anterior had how many branches? 3. And posterior had how many branches? 4. Right? Okay, so off of this trunk now, we can do 1. Let me use a different color. Let me just go ahead and erase everything else. Actually, let me put it down here. Let's draw it. All right, so 1, 2, 3. All right, and for this one, I'm just going to taper this a little bit. So it's just 1, 2, 3. Make sure you get that. Okay, this one is going to be a little bit weird. So this one is like 1, 2, 3, and the other one is like slightly like that. All right. Okay, now to remember this one right here, we're going to use MTM. To remember this right here, we're going to use MDL. And then to remember these ones over here, this one is a little bit more, so Lima. Okay, so for so the first M is going to be your middle meningeal. All right. Remember, this is a trunk. Right? So this here, so this first one is your middle meningeal. So your second one, a second here. Make sure I have all this stuff here. All right. So the second one is going to be your tensor veli palatini and your tensor tympani. Tensor tympani and tensor veli palatini. This is the second one right here. I will show you guys this again. The third one is going to be your medial pterygoid. Medial pterygoid. So that's MTN. Middle meningeal, tensor veli palatini, tensor tympani. Right? And then this is going to be your medial pterygoid. Okay, so then for your MDL, so you're going to have your masseter, all right? Then you're going to have your deep temporal nerve. So the D is for deep temporal nerve. Then for 3 is going to be your lateral pterygoid and buccal nerve. Lateral pterygoid and buccal nerve. So L is lateral pterygoid and buccal nerve. And then for this,
Who saw us somewhere?
No, that's what we said. We
see
didn't.
all.
We didn't see all this a lot. But we should know what it is in theory.
Yeah, some people have done cool.
Hey, Moses.
Hmm?
Those are two separate nerves, right? Lateral pterygoid nerve and medial nerve.
Yeah,
Okay.
they're separate, but they're like coming off of the same thing here.
What's
Okay.
the end of the D again?
Gotcha.
Masseter
Yeah.
and thank you.
Usually that's what they gonna find. It's like,
Okay. Okay, so then just finishing this off. So the L is going to be for your lingual. The I is going to be for your inferior alveolar. The M is going to be for your mylohyoid. Right? And then the A is going to be your auriculotemporal nerve. Cool? All right, so let's see this again. Let's look at it again. So here, this is what Dr. Shaw has. All right, so this is your trunk. All right? This is anterior, and this is your posterior. All right? You guys see that? Okay, so foraminal valley, right? We have our V3 mandibular coming down, and then it's going to give off 3 branches. MTN, NTM, right? Middle meningeal, that's the first one, right? T is what? Tensor villi palatini and our tensor tympani, right? Then the M is going to be for medial pterygoid, right? That's the trunk, right? Then for the anterior, so we said it was 3, 3, 4. So anterior trunk was 3, anterior is 3. So we have 1, 2, 3, right? And we had MDL, right? And where M was what? The masseter. What was the D? Okay, deep temporal. Okay, lateral pterygoid. MDL. And then for the posterior, so we said it was 4, right?
Yeah.
And what was the mnemonic for that? Okay, line up. All right. So then this here is the lingual. This here is the inferior alveolar. This here is your what? Mylohyoid. And this here is your what? Auriculotemporal. All right, do you guys see that? So I'm gonna test you guys at the end. We'll just do like a little quiz on both of these so that it sticks a little bit better. Yeah. There's something that it passes around. Is it middle meningeal? Okay, so it passes around the middle meningeal artery. So. Okay, so you guys feel a little bit better with this, right? Yes? No? You guess? Maybe? Okay. All right. Okay, so we just have one last thing. Then I'll ask you guys some questions. Okay, so we kind of talked about the TMJ, so the temporal mandibular joint. So this is it right here. So we have what? We have the temporal bone. We have the mandible, right? So we have the coronoid process. We have the condyle. So if, let's just say this right here is your temporal bone, right? And then let's just say this Actually, no, this is not good. Okay, so say here. So let's say this is your mandible, right? And let's say this part right here is your condyle. So here we're gonna have like an articular cartilage. So basically our TMJ would be right like here. Right?
So it
So-
just stands for temporal mandibular junction.
Temporal mandibular joint.
Joint. Oh, okay.
Right. So now we're gonna have like a space. We're gonna have a space on top, and we're gonna have a space beneath. Now notice that what muscle is gonna be attaching to this? Okay, so lateral pterygoid. And that was the superior head, right? And then the inferior head, or the lower head, is going to be attaching onto this condyle. Right? Okay, so it turns out that there's two kinds of motions that's going to be occurring at the top here and at the bottom here. So at the top here, you're going to have a kind of like gliding kind of a motion. So it's like gliding, like so. Whereas on the bottom is more like a hinge. So like, you know, this mandible will actually just like hinge. Can you guys visualize that? So on top is more like you're sliding. It's like you're sliding. But on the bottom, the kind of motion that occurs is like a hinge, kind of a hinge joint. Cool? All right, so that's just a little bit. Okay, so now there are four possible type of movements. So you can have the protrusion, right? You can have the retraction, you can have the elevation, and you can have the depression. So elevation meaning you're closing your mouth, depression meaning you're opening your mouth. So here, let's see if I can get okay, here. So here's our TMJ, right? Right, the TMJ right here. Now, so protrusion would be like so. Retraction would be like so, right? Then depression would be like so. And then elevation would be like so. So if you're elevating, then you're closing your mouth, right? If you're depressing, then you are opening your mouth, right? So there are four major muscles that, or four muscles that are going to be helping to move this TMJ. All of them are innervated by your V3. So you have the lateral and the medial pterygoid, the masseter, and the temporalis. All right, I was trying to figure out a way to help you guys to also memorize this as well. So, let's see. Sorry, were you saying something?
Down the side of your face.
Sorry. Huh?
Isn't it everything down the side of your face? The temporalis, the masseter, the medial, lateral.
Okay. That's one way you can look at it. If you're looking at it this way, right?
Yeah.
Okay. So you can look at it that way. Okay, well, if you remember, if you remember the lateral pterygoid and the medial pterygoid, because these guys are going together, right? Well, actually, okay, let's just, if we use LMMT, so this would be the pterygoids. Right? This would be like your pterygoid muscle, so this would be the lateral and the medial. if this is the lateral pterygoid and this is the medial pterygoid, then this must be the masseter, and then this must be temporalis muscle. Okay, then if you look at the action of the lateral pterygoid, it's going to open and it's going to protrude the mandible. So it opens and protrudes. If you look at the temporalis, it does the exact opposite. All right, so it's going to close and it's going to retract. So these are, at the poles, you have opposites, right? Do you guys see that?
Yeah.
Okay, then taking a little bit further here. Okay, when you look at the M and the M, so this would be what? The medial pterygoid and the masseter. So both of them are going to be closing the mouth and also involved in protrusion. So the M and the M are like almost have similar, they have like almost identical functions. All right, so these guys are going to help to close and protrude. So that's M and M. But so what I saw in the table that Dr. Shaw had in her lecture, so the medial pterygoid is going to, lateral pterygoid. The lateral pterygoid is going to be helping to move the jaw side to side. Cool? This is just a way for you guys to just remember this, right? So if you remember that, so if you have the lateral pterygoid, the medial pterygoid, so lateral pterygoid, medial pterygoid, masseter, then you have your temporalis. So you just remember that, if you remember that the lateral pterygoid, if you remember that it opens and protrudes, you should be able to figure out everything else. Because you remember that the T is opposite, right? And then you just remember that the M and M is the same, right? Maybe, okay. Let's see if I can. So just remember that, so the close, so basically starting from the bottom, all of them are closing. And the only one that's opening is going to be your lateral pterygoid. All right? And then you can kind of remember that you can remember that this guy protrudes, and this guy protrudes. Right? So it's just a way to kind of help you to remember what does what. I guess in the exam scenario. Okay, so that's essentially what I had. So did you guys have any questions? I'm just gonna ask you guys some questions and then try to see how much we can retain. So did you guys understand the stuff, or yeah?
It's just a lot.
You
It's
say
not-
that
I try to,
this is
yeah.
the most important stuff that we need to know from the lecture.
Okay, so now Dr. Shaw didn't give this lecture during our year, so it'll be hard for me to.
Who gave it?
It was Dr. Aziz. Yeah, so he's retired. And when his lecture was actually 1 hour long, whereas this lecture was 2 hours long. So I'm not exactly sure what questions she will ask. I remember.
She likes this a lot because
She's what?
she works with folks.
Oh yeah, she was talking about.
What?
She was in her feelings in the lecture about how phenomenal it is over in the dental school because she has talked on and on and on. All the lovely things that happened in Milford.
Hopefully she won't give us dental questions. That's what I hear.
Yeah. Oh, that's what the other thing?
Oh, I don't know if he's still there.
He's still here. I just saw him today walking with some fellow colleagues. He waved hi, waved back.
Those are his parents.
Those his
I
parents?
think so.
What?
But anyway, sorry. Let's just say that they
No, a lot of them also work in dental school.
Yeah.
Yeah, but I think Shaw like really likes this lecture.
Well, she was just talking about
I'd
yoga.
probably say
Yeah. Yeah, she got a white coat from the dental school.
Yeah.
I'd probably say also know about the hitchhikers, those parasympathetic hitchhikers.
Yes.
That'll be very important.
Oh, it is ganglion and the
Yeah,
chordae tympani.
what they're going with.
Oh, it is? Ganglion was approved.
Well, the lesser petrosal is going with the auriculotemporal via aortic ganglion.
Oh, because when she, in her lecture, it's literally chordae tympani or the ganglion.
Yeah, this chordae tympani is what is.
And that goes with label. That goes with
Yeah.
label, man. No, right.
Yeah.
I don't know.
Yeah, because the lesser petrosal goes to the aortic ganglion and that sends a branch to the auriculotemporal to go to the thyroid.
Okay.
Hold on, Kathia, one more time.
Right.
Lesser petrosal to aortic ganglion, and then what?
Remember, glossopharyngeal is the one that comes out, and then it'll send a branch back up. So it goes in, and then it comes out again as lesser petrosal.
Okay.
That goes to the aortic ganglion. That hitchhikes on the auriculotemporal to go to the parotid, so you can spit.
What?
That's
Oh,
all.
glory.
And both the aortic ganglion and chordae tympani are both parasympathetic.
Chordae tympani has taste and
Okay, so
parasympathetic.
Look at
no,
you.
I mean no. Okay, so okay, so so what I okay.
Come on, profile.
All right. I think I should be good now. Okay. So so we're looking at the veins. And I want to see if you guys can remember. So here, let's just say that here is your pterygoid venous plexus. All right. So let's just say this is X and this is Y. And then let's say that this right here is Z. Okay, so let me begin here. Okay, and how about this too? Let's say this is K and F. Okay, let's see. Who am I gonna pick on? How about I try Alexander this time? So I know this is a little bit confusing, and if you don't see what I drew, it's okay. My feelings are not hurt. So so what do you think Z would be?
Is that your retro?
You got it, retro, and M something.
It's not mandibular, is it?
Yeah, it is.
Oh,
Retromandibular.
Oh, is that Z or what?
This right here?
Z, right?
This is Z.
Okay. What's one?
Why?
Z is an internal jugular?
Yeah.
It's internal jugular.
Z is
Well, Z is
internal.
internal jugular.
Yeah.
But he's
Okay, so
Oh, you were just saying.
he was trying to pronounce. He was trying to,
Oh,
and I was. You see what I'm saying? I was
you weren't
saying.
saying he was correct.
Yeah, I was
There's
saying.
such a thing as a retromandibular.
I was saying that he pronounced the. He pronounced the retromandibular correct.
Oh, okay. Isn't that also
You were
like?
right.
Sorry.
It's all good. It's all good.
Alright, yeah, so Y would be retromandibular draining into your, is it internal carotid? Oh, sorry, internal jugular. Internal jugular thing?
Okay. Yeah. This would be retromandibular, and this would be internal jugular. right. Alana. So, what is F?
I was just thinking about that. Okay, if that's retromandibular, it joins with the leg. Let me guess this. I'm like, I know we just talked about this.
Oh yeah, you got through.
Huh? Facial nerve.
That's right.
Facial vein.
Yeah.
Wait, what?
That's right.
Wait, I want to say afrofacial, but
That was a mistake.
Yeah, I was like, I don't hear
That was a mistake.
That
That was a mistake. I
That's
didn't.
not facial?
It is.
It
But I'm
is
saying.
facial.
I'm
You
saying.
didn't put F.
Oh.
Yeah, that was a mistake. I don't. Yeah. Okay. So how about right here? What would this be? So let's see if I call this X. So Osbon, what do you think this would be?
Angularis vein.
Not
Angular
angular.
vein.
Okay, angular vein. That's right. Okay. And how about K? What do you guys think K is?
Cavernous sinus.
Okay, cavernous sinus. That's right. Cool. All right. See if we can
Oh no.
Okay, Osman. What division is this?
Oh, inferior.
Okay. So what am I pointing at here?
Long buccal.
You guys agree?
Where?
Yes.
Oh, that's,
Right here?
Three.
Yeah.
Isn't that lateral?
He's a non-buccal. It's another term for it.
It's two things there.
Yeah.
That's okay.
So one of them is long buccal, and the other one is what?
Yeah, it's,
Wait, I thought it was.
is number 3 like the official name? You can call it long buccal, but it goes to both the lateral pterygoid and to the buccinator.
Here, let me
Yeah.
Yeah, I was
let me
gonna
kind
say
of clarify this.
lateral
I'm sorry.
pterygoid.
I'm sorry I didn't clarify this earlier. Okay, so okay. So here. This is lateral pterygoid muscle. Right? Now here we have the lateral pterygoid branch, and then it's continuing off, and I believe this would be like the buccal. So, but it goes in to that lateral pterygoid muscle, and then it continues as like that buccal.
So it's like a little pit stop.
Yeah. Do you guys see it? So it's two nerves. Well, two nerves innervating two things. Okay. So going back here. All right. So Osman, not to pick on you again. Sorry. I apologize. So I don't know what 3 is. What would 3 be?
Myohyoid.
Okay. How about 1?
Lingual.
Okay, that's right. Now, we didn't talk about this, but so this lingual nerve, there's another nerve that joins with it. So we have the lingual, and there's another nerve that hitchhikes with it. Quarter tympani, that's right.
Well, is it hitchhiker or is it it's a hitchhiker, right?
It is a
Okay, I think I called it a hijacking one.
What? Like,
I'm taking your word.
That's what I call a hijacker.
So we have the quarter tympani, and it's getting a little ride down to where it needs to get to. Okay. So we have here. We have the lingual, then 2, inferior alveolar, then 3 is what? What's 3 be? Myohyoid, right? Then 4 would be what? Auricular temporal. 2 is going to be what?
Inferior.
1 is going to be what?
Lingual.
4 is going to be what? 2 is what? 3 is what? Okay, cool. Okay, now looking at, okay, so remember this is the trunk, this is the anterior, this is the posterior. Okay, now looking at this trunk here, what would 1 be? What would 3 be? Okay, medial pterygoid. 3 is medial pterygoid. 2 is what? Okay, so tensor veli palatini. Now let's see if we can try to get a way of maybe just getting a way of remembering these. Okay, where is this? Okay, so this was the third one, right? In the trunk is the third one. Okay, so we have tensor veli palatini and tensor tympani. So we have ini. So tensor ini. So tensor veli palatini, tensor tympani. All right, I'm just trying to make your life easier, you know. That's all I'm trying to do. That's what I'm trying to do. All right, so. Okay. Okay, so what was 3 again?
Medial pterygoid.
What was 2?
Tensor veli palatini, tensor tympani.
Okay. Then what was 1? All right. What's 4 here? Okay. What's 2? What's 1? What's 3? Okay, cool. What's 2? Okay, whatever, the 2 T's. Okay, so how about okay, how about 1? What's 1? You guys sure? Okay, that's right. Okay, how about 3? Okay, cool. How about 3? How about 1?
Lingual.
Okay, how about 1? So what nerve is hitching a ride on lingual? Okay, so what is 2? Okay, cool. Now what is 1? Masseteric, that's right. What is 3? Okay. I saw buccal nerves. I think there's a difference between buccal and long buccal.
So
Well, I can remember from first year, but
my understanding of it is that the whole nerve is called long buccal, but it's mixed until after the lateral pterygoid because it's giving off its motor fibers to the lateral pterygoid for mastication. But once it leaves the lateral pterygoid, it's purely sensory, and that's why they call it the long buccal because then by then it's just pure sensory to the maxillary because it doesn't give any motor fibers to the maxillary.
So is it long buccal or is it buccal?
I heard long buccal.
Long buccal?
I can go by both, but so that it doesn't get confused with the branch from the facial, people will say long buccal.
Oh, okay. I see.
Yeah.
So long buccal. I could have sworn I saw buccal on her. Let me see. See what she has. Really?
That's how I studied it. It was long buccal.
Alright, this is just messing me up. I'm trying to grab it, but. Alright, whatever. I give up. I can't grab it, it's too small. Did you guys see what I was doing?
No.
Like I was literally trying to grab this thing to move it, and I couldn't grab it. So, just forget about it. Okay, all right, let's get back. Okay, so we're just gonna maybe just do a little bit more cycles through this, just to ensure that you guys have it, and then we'll try to do a cycle through this guy right here, and then we'll call it a day. All right. Or how do you guys feel? Are you guys tired? It's 7:16. If you guys are tired, we can just do one and then call it a day. So it depending on how you guys
I don't
feel.
think we have any choice.
Tired,
If I had
Huh?
a choice, I would no, but I don't have a choice.
That's not a fair question.
Oh, okay. Okay. So do you guys want us? I mean, it's totally up to you guys.
Can we do the arteries?
Yeah, we will.
So we do that.
Just the arteries? Okay.
You gonna learn today.
We gonna learn today, cause I cannot figure it out any other day this weekend. This is not gonna be on the top of the priority.
All right. So you guys remember, right? We said there's going to be how many divisions?
3
3 divisions, right? First part was for what?
halls,
Foraminus. Second part was for what?
muscles,
All right. The third part was for what?
pterygoid,
What?
Pterygopalatine fossa, right? Okay, so for this first one, there was 2 arteries, and they were going to where?
The ear.
That's right. They're going to the ear. And then there was 2 more. That's right, to the brain. And then there was 1 going to the mandible, right? Alright, so I'm just going to label these 1. Okay, so here I'll label this thing. So I'm going to call this 1, call this 2, let's call this 3, call this 4, call this 5. One second here. All right, cool. Okay, so number 1 is going to be your deep auricular. Number 1 is your deep auricular, right? And then number 2 is going to be your anterior tympanic. So 1 is your deep auricular, 2 is your anterior tympanic, 4 is your middle meningeal, 5 is your accessory meningeal. So 4 and 5 meninges, brain, 1 and 2 tympanic, auricular has to do with the ear, right? And then 3 is your inferior alveolar. All right. Okay. So what would 2 be?
anterior tympanic,
Okay, 2 is anterior tympanic. What about 3?
inferior alveolar,
How about 1?
deep
Deep auricular. How about 5? How about 1?
Middle meningeal.
Not middle meningeal. That's 1.
I'm thinking 4, my bad.
That's all good. It's all good. Okay, so 1 is what? 3 is what?
inferior
4 is what? 5? 2? 3? 1? 2? 4? 3? 5? 2?
anterior tympanic.
That's okay. Okay, cool. All right, cool. All right, okay.
It's that tremor of intention.
It's a delay.
All right, okay, so, no worries. Okay, so let's move on to the second part. Okay, so remember what we said for this? The mnemonic for this was deep. And what was the remaining of this?
BPM?
You have
Okay, BPM, that's right. This is this is actually good because it's bone morphogenic protein. That's where I got this from. Bone morphogenic protein.
I was thinking beats for a minute.
Bone morphogenic protein. I mean, I think that's classic, right? Bone morphogenic protein. Deep bone morphogenic protein. All right. Anyhow, all right. I know my jokes are not too funny, but okay. Okay, so we're gonna have two things sticking out, two arteries sticking out. Then we're gonna have like three going down like so. All right, so that's bad color. It's too small. All right, let's call this 6. Let's call this 7. Let's call this 8. Let's call this 9. Okay. Okay, so now let's go. Okay, so P here is gonna be for your pterygoid. P is pterygoid. M is going to be for your mesenteric.
Both pterygoids?
I'm not 100% sure. I'm not 100% sure. I think so, but
What should I?
he said if the artery is going to both pterygoids, I would say yes, but again, not 100% sure. You guys can look it up. Google is our friend.
Google won't come to test
Google is your friend.
Okay.
So utilize Google. Okay, so 6 is your pterygoid, 7 is the masseter, so pterygoid, masseter, and then the 9 is the buccal. So pterygoid for 6, masseter, buccal, and then this is temporal. The temporal is on top, and that would make sense, right? Because temporal muscle, the temporalis is a what? Is on top, right? Sorry, say that again.
Oh, because deep. The deep is for deep temporal.
Yeah, deep temporal. Deep temporal.
Yeah,
I'm sorry. Because it's temporal, right? I mean,
Yeah.
yeah. Okay, yeah.
Because you have two, because you have an anterior deep temporal and a posterior deep temporal. Also true. Yes. Okay, so that's why there's two.
Okay, so all right. So what would 7 be? Mesenteric, right? Because that's the M, right?
Yeah.
Well, how about 9? Buccal, because that's the B, right? And how about 6? Pterygoid. All right. How about 8? Deep temporal. How about 7?
Master.
I'm gonna just remove that. I'm gonna remove that because I think you guys are cheating.
Masseter.
Okay. How about 9?
Buccal.
6?
Pterygoid.
8?
Deep temporal.
Why is 8 have 2 lines?
Because it's actually 2 vessels.
Is it mesenteric or master?
It's actually 2 vessels.
So if they tell you to be specific and there's 2 in there, see which one is anterior.
Is it mesenteric?
Posterior.
Is 7 master?
And
Or is it master?
Master.
be specific.
Okay.
There's like a bunch.
So you know to say anterior, posterior.
Okay. So how about 3?
Really, bro?
Yeah, we're going back. We're going back. We're going back.
All of them will now.
Okay.
All right. Okay. So how about 1?
Deep irregular.
How about 2?
Anterior sympathetic.
Wow. That's amazing. How about 3? How about 3?
Inferior alveolar.
Wow. Okay. How about 8?
8?
What?
Yeah.
8
8.
Temporal.
How about 7?
Mesenteric.
How about 9?
Buccal.
6?
Pterygoid.
Oh dang. You guys are scaring me. Okay, how about 4? 5?
Accessory meningeal.
I thought you guys didn't know this stuff.
Well,
We didn't. Hey,
yes,
we
we
got
Prior
to this situation,
Prior
we
to
were
you.
like, that's cute.
I couldn't tell you where it was. I couldn't tell you.
Okay, all right. So let's just finish the last one, and
Let's
we'll
hope
call
on the
it.
test this match who shows up. I can label this particular.
No,
No,
the
his
worst would be
personal
like
drawing.
members.
I can label his personal drawing.
All right. So for the third part, what was the mnemonic for this third part? You guys remember what the mnemonic was for this
Is
third?
app.
That's right.
Is app.
It's app. Hey.
I don't know what any of those things mean. You know, there are 3 P's though.
Is it infraorbital?
Girl.
I'm guessing.
Lies.
Is that what it is?
Maybe the lies.
Is it infraorbital?
It's
It is infraorbital.
Yay!
It is infraorbital.
And
All
the
right.
A is artery for pterygoid.
That's right.
Look at you.
That's right.
No, yeah, that's right. That is
All right. So we're gonna draw.
shockingly.
So you guys are getting this. I'm happy. I did something right today. I did something right today. We'll go home happy.
Wow. I'm gonna be happy because there's ice cream already at my house.
That's real.
Me, the ice cream, and
That's a date night.
All right. So how about
I don't want it to be.
10,
I really wanted to go get
12,
macaroons, but that close to 7.
Oh.
13,
Girl, put that stuff.
14.
Oh, Lord. Get that.
All right. So let me point these out to you guys for the last division. Okay. So for 10 is your palatine. Remember again, that's A, right?
Palatine. Okay. So first,
Palatine, right? Then the 11 is going to be posterior superior alveolar.
posterior superior alveolar.
So posterior superior alveolar. That's the second P. Then the last P is your pharyngeal.
So
Pharyngeal.
Pharyngeal, posterior, superior,
So it's
alveolar. And what's the last?
Palatine,
palatine,
posterior superior alveolar, and then pharyngeal. And then A is going to be your artery of the pterygoid canal. So that's this right here. Artery of your pterygoid canal. And then 14 is I, so that's your infraorbital. And then 15 is your sphenopalatine. Sphenopalatine, whatever.
So going from 10 to 15. So we have
Right?
Palatine.
Palatine, that's right.
posterior superior alveolar.
That's right.
We have pharyngeal.
That's right.
We have artery of pterygoid canal. We
Yeah,
have
Infraorbital.
that's
and we
right.
have sphenopalatine.
Palatine.
Okay.
Girl.
Can y'all say that again?
You guys are good. You guys are good. Go ahead, do it again. Do it again.
10. So 10
You guys are good at this.
is palatine.
Palatine.
11 is posterior superior alveolar.
Posted alveolar.
12 is pharyngeal.
That's right.
13 is artery of palatine canal.
Good.
Pterygoid.
Pterygoid.
Pterygoid canal. Pterygoid canal.
Pterygoid canal.
14 is supraorbital. And
Infraorbital. Infraorbital.
Is it SI?
No, it's 14 and then like 14.
I
yes,
goes before
I.
S.
Yeah, so it's like,
Yeah.
So
We number them differently than the order in which they appear.
Why?
Because
that's what
that
you
way
did.
it's like is
That's what
you see it?
Infraorbital. Thank you.
But the. Cause
I don't know.
It can't be is. It can't be is app.
It is
that. That's why I
It
think
would
he
be
did it
C
that way.
app, right? Or sit app.
He
right?
did no.
They're not ordered in any particular order.
Wait, it's spheno.
Here.
Wait, are you saying, this is spheno. Sphenopalatine. Spheno.
That comes before the infraorbital.
So,
He know-
I is infraorbital, S is spheno.
Right.
Spheno.
So why do you number the
She's saying why is it 15
Oh,
14?
oh, don't worry about that. I mean,
He just numbered it like that.
I mean, just yeah. It's
Yeah.
not. That's not
We're gonna change the numbers.
too. It's not too important.
Competition.
Challenge.
Okay.
Come on, challenge.
Okay. So palatine, posterior superior alveolar pharyngeal artery to
Pterygoid.
Pterygoid canal, inferior or infraorbal, and then sphenoid palatine.
Okay. Cool. Cool. You guys are on a roll here.
It's short term memory is great.
Right, that's all.
Ask me to
Post
write.
it, like, you can either post this document.
I'd be like, I've never seen this before.
Right. What art? Where?
Okay.
There what?
All right. Okay. So what's 11?
Posterior superior alveolar.
Okay. How about 10?
Palatine.
How about 15?
Palatine.
I object.
How about 14?
Infraorbital.
How about 12?
Pharyngeal.
Pharyngeal.
How about 13?
Artery to
Artery
pterygoid.
to pterygoid.
How about 8?
Deep temporal.
How about 5?
Accessory meningeal.
How about 1?
Deep
How about 6?
Oh.
It's pterygoid. Okay, how about 9?
Buckle.
Okay. How about 3?
Inferior.
Alveolar.
Okay. How about 11?
Posterior superior alveolar.
Interesting. Okay, how about 6?
Pterygoid.
Okay. All right. So you guys are on your way. You're on your way.
Ask me in 2 hours.
All right.